The COVID-19 pandemic has confounded the racism pandemic. This is not a session where it's teach your grandma how to suck eggs or a mandatory tick box training session. I hope that as a result of being part of this session, you feel that you truly gained something and that you will genuinely make some changes to how you process things when it comes to race, inclusion, and ethnicity. And no matter how small the change, we all have scope to improve ourselves, irrespective of our backgrounds. I hope that there are parts of this talk that you find controversial or even disagree with. That's what will make this session interesting and enjoyable. Hopefully we should have enough time at the end for questions and discussion. It is an interactive session. There'll be some exercises we're going to do during this session as well. So the pandemic, as you're aware, has shone a spotlight onto the inequalities that already existed in our society and also in our health service, and has widened the gap between minority communities and the rest of the population. At one point during the first wave of the pandemic, over 90% of all of the deaths of doctors in the UK were of doctors belonging to Black and ethnic minority backgrounds. Throughout the whole pandemic, the majority of deaths, both in the healthcare setting and in our society at large, have been of people belonging to Black and ethnic minority backgrounds. This is a disproportionate and negative impact on ethnic minority communities, and it can't be explained by chance alone. And many different explanations have been provided, but they can be divided broadly into three main categories. And the first one is the genetic theory. Some people suggest that genetics predispose certain ethnicities to be more susceptible to contracting coronavirus. However, genetic differences between ethnicities determine certain phenotypic characteristics such as hair texture, skin color, eye color, but these genetic differences cannot be responsible for susceptibility of an individual to contract coronavirus or develop complications requiring hospitalization. Many people have suggested that the genetic theory was used by some people to absolve their responsibility to address the more likely determinants of health inequality, which are much harder to address, such as social and financial deprivation. The second theory was that people belonging to Black and ethnic minority communities have a higher prevalence of comorbidity, including metabolic disorders such as diabetes, heart disease, and respiratory problems, making it more likely for these groups to contract and develop complications of coronavirus. And this is a sensible and valid theory. The third and most likely explanation was the societal and wider determinants of health. We know that Black and ethnic minority communities tend to live in areas with higher population density. There are also trends that there's higher prevalences of multi-generational living, and Black and ethnic minority communities tend to be less financially well off than their white counterparts. Black and ethnic minority communities tend to have poorer access to high quality healthcare and also tend to work in front-facing public services, where they're more likely to be front-facing and therefore at higher risk of contracting the virus. Ethnic minority workers are also less likely to raise concerns to their employers or line managers if they felt that they had concerns or if they felt that they had inadequate infection control training or access to PPE. The population at large has 14% Black and ethnic minority individuals. Black and ethnic minority individuals make up 40% of the NHS, and so therefore a 90% death rate of Black and ethnic minority healthcare workers is significantly disproportionate. The proportion of BAME individuals at board level and senior strategic positions of leadership in the NHS is not representative of the overall proportion of the composition in the NHS at large and in the population. This may make it less likely for culturally sensitive and specific and ethnically appropriate risk mitigation to filter to the shop floor level on the front line in the NHS, making it more likely for Black and ethnic minority healthcare workers to contract and develop the complications of coronavirus. In the healthcare setting, it could be that higher proportions of Black and ethnic minority workers working for agencies which are used to plug the gaps in the service provision. And these tend to be on the front line, making it more likely for BAME individuals to contract the coronavirus. It's unlikely that there was any one single factor in the disproportionate impact on the BAME communities. And it's probably more likely that there is a multifactorial explanation. That doesn't, however, detract from the fact that there has been great devastation to Black and ethnic minority communities, which has been disproportionate. More could have been done at an earlier stage to try and address these inequalities. I believe that the BMA and the RCGP have been proactive and vocal in raising awareness of these issues from the beginning of the pandemic, and they have made significant headway into both risk assessment and implementation of risk mitigation in healthcare settings. There is still much further work required to ensure that moving forwards, we value all members of our society and healthcare workers equally. Despite this, I feel we're still blinkered. The recent JCVI risk stratification relating to who has clinical priority to receive COVID vaccines first did not feature ethnic minorities as an at-risk group in the first description when the vaccines were approved by the MHRA, despite the irrefutable evidence. Why do we continue to make the same mistakes over and over again? I can't breathe. These were the 3 words uttered by George Floyd as his life was extinguished beneath the knee of a police officer in the USA. Tragically and somewhat ironically, these are also the words uttered by many who are on the ITU that have severe respiratory complications due to COVID-19. 2 different diseases, but the same tragic outcomes. And this was the sad tale of 2020. Now, I'm going to move on to the main body of the talk and cover the following topics by sharing personal examples and stories and discussing personal reflections of real examples of racism that myself, my family, and friends have experienced. Hopefully, it will make us all think about how we can challenge our own subconscious biases and prejudices, and how we can all treat each other with more kindness and consideration. We are now going to do an interactive exercise which works really well face-to-face, but hopefully by utilising technology, we can make this work virtually. You'll need a scrap piece of paper and a pen or a phone. I want you to imagine that you're on the start line of a 100-metre race. I'm going to ask you 8 questions. Your responses to each question will determine if you move forwards by 10 metres or backwards by 10 metres. Just tot up your score as you go along at the end of each question, and then you'll have a score at the end of the 8 questions, and you'll have a new starting point. So hopefully, as we go along, it will make more sense. So the first question: if English is your parents' first language, move 10 metres forwards. If you've ever been the only person in the room of your race, move 10 metres backwards. Question 3, if you've never been asked where you're from, move 10 metres forwards. Question 4, if you've never had to be worried that any of your family members will be stopped and searched, move 10 metres forwards. Question 5, if your parents have ever warned you about racism, move 10 metres backwards. Question 6, have you ever felt that you have been the victim of racism? This could be verbal, physical, institutional, implicit, explicit. If that's the case, then move 10 meters backwards. Question 7, has your name ever been repeatedly mispronounced? Or do you have to purposefully mispronounce your name or anglicize your name so that it is easier for your friends or colleagues to pronounce? Or have you adopted a nickname as your friends or colleagues are not willing to learn to pronounce your name correctly? If that's the case, move 10 meters backwards. And finally, if you've ever been made to question what your role is in this country and or question your belonging based on your race or ethnicity, move 10 meters forwards. So at the end of these 8 questions, you should have your own personal score. A poll will now appear on your screen. Please click on your score. It's all anonymous. We can then see the spread of the scores. So we'll have a spread between -40 for the most discriminated against and a +40 for the most privileged in our society. So if you can just click on your score, which applies to you, and then press submit, hopefully soon we will see the spread in our audience and we'll have a chat about how that affects us. That's a really interesting result. Obviously, it depends a lot on the composition of our audience and the ethnic mix and the cultural mix. But as we can see here, we've got a peak at +30 and 2 other peaks. Well, kind of, you know, we've got a big peak if we combine the +30 and +40. That's the majority. And then we've got +10, and then we've got -40 at 14%. So, you know, if we can just hide the poll now, we can publish that at a later date. It's really interesting. That's great. So, as I said, there's a big spread there of what the results could have been. And if this was a race, would it be a fair race? How does your starting position make you feel? Do you feel you would have to work or try harder to compensate for your relative disadvantage? Or would you simply admit defeat and succumb to learned helplessness and hopelessness? My parents always told me that I would have to work 10 times harder than my white counterparts in this country in order to reach the same level as them. This was drilled into me from a young age. I was forced to look inwards and work and try harder to address these inequalities rather than society looking outwards and acknowledging these inherent biases and choosing the harder option of changing societal norms and challenging privilege. Subconscious bias is often evident in how we think and the language that we use. Now, microaggressions is a term you may have heard of. Microaggressions are designed to denigrate the individual and reinforce the inability to view people as individuals, but rather see them as their protected characteristic. There is nothing micro about microaggressions. Their impact can be significant and their effects can be devastating and anything but micro. The prefix micro almost confers acceptance of this racism and belittles the impact that they can have on the victim. These so-called microaggressions can curtail and fetter the potential and the self-confidence of the victim to such a degree it can push them into a pit of learned hopelessness, into self-isolation and a negative mindset, which itself becomes a self-fulfilling prophecy. Ethnic minority groups are made to feel like we don't belong and regularly question where we fit into society and into the system. We get microaggressions thrown at us over and over again, and we're labelled as inferiors, and after a while, we begin to believe it. The labels start to stick. This is the beginning of the downward spiral of ethnic, cultural, and racial societal decline. This is what my ancestors experienced when we were conquered by the British Raj 400 years ago for about 300 years. The the habitual physical and mental denigration of a whole population or a whole nation, of a whole race and culture. After a few generations, the slave master mentality became ingrained into the system, which became the societal norm. My parents are an example, my grandparents. Always, they had a deep-seated respect and fear for white people over any other race, which was born out of a sense of generational fear. As children, we were taught to put up and shut up and tolerate abuse and discrimination at school and thereafter. We were taught never to speak out against racism or to confront it, as this would bring shame onto our family and onto our race or religion by playing the victim role. It was also give us a bad name and label us as troublemakers and risk us being deported. These were the fears, however irrational they may seem. We were always advised to excel in our studies so that we could propel ourselves into a higher social class through social migration and escape the physical and verbal explicit racism. But little did our parents and grandparents know that the implicit, indirect institutional racism was a stealth form of discrimination, which could be far more damaging than the name calling in the streets that they were accustomed to. So microaggressions have been likened to death by 1,000 cuts. One cut may be tolerable, but multiple cuts or repeated biases can be intolerable. So split-second judgments are also very important. We all make them. These are evolutionary. When you see a white person, for example, do you instantly label them in your mind as the white person or just a person? But when you see a Black or Asian person or a Chinese person, do you instinctively label them as a Black person or an Asian person or a Chinese person or just a person? I'm asking you to think about your own personal analysis. I'm talking about split-second judgments, not after you've had a few minutes to ponder over it. This is unconscious bias, preconceived bias, which we automatically make through our own learning and experiences. No one is born racist or discriminatory. We have had so many Black and Asian registrars at our practice over the last 10 years. We're a large training practice. I've been a partner there for 10 years. When patients try to describe which doctor they've seen to me, without exception, they'll always say, it was the coloured doctor. This is a racist term in itself and reflects the mindset of the population I certainly serve. But if you have to say the Black doctor or Asian doctor, that is unconscious bias right there. Never in my experience has anyone described the white registrar as the white doctor, or used physical descriptors such as hair colour or body habitus to describe white doctors, whereas other physical descriptors are commonly used by patients to describe ethnic minority doctors. This is not okay. This needs to be called out, and the perpetrators need to be educated in a supportive way. When I was eating a carvery once, someone I didn't even know came up to me and said, "Oh, do you eat white food too?" Sorry, the last time I checked, the food didn't have a colour or a race. Should I be eating chapatis and curry with my hands sat on the floor, cross-legged on a Hessian mat, just because I'm brown? Other food microaggressions that I've experienced are, "Oh, do you eat pork sausages?" based on the misassumption that all people that are brown are Muslim. How many times do we say things like the tall girl, the Black doctor, the disabled man, the ginger person, the thin boy? Why are we so quick to label people in our own minds and define them by focusing on their differences? People of colour in predominantly white settings ask themselves these questions daily. Why am I continually defined by my race or colour, rather than by my talents or personality? Why? Because they have been on the receiving end of microaggressions their whole lives. This may have had a negative impact on their self-worth and self-confidence, made them feel denigrated, and have often held themselves not achieving their potential through discrimination. BAME people are fed up with continually being on the receiving end of these derogatory microaggressions, that it's had a significant impact on their mental health. There's a lot of research to back this up. It can create an imposter syndrome. This can be defined as a collection of feelings of inadequacy that persist despite evident success. Imposters suffer from chronic self-doubt, a sense of intellectual fraudulence that overrides feelings of success or external proof of their competence. Should we just accept this as human nature and accept that this is evolutionary, or should we accept and acknowledge that these are deep-seated learnt biases that we all possess to a certain degree, and make the difference and start making the change and challenge our own judgments? There are some recurrent narratives that we repeatedly experience or crop up in our conversations about race, some which we don't even think are racist, especially from those who don't want to talk about inequality or existence of racism. We may think we know these narratives, but it's still important to examine them and challenge them. This isn't so we can have a scrap, but more about understanding perspectives to foster productive conversations. A few common themes include the idea that racism is largely over or dying out over time, or minority groups being obsessed with race, claiming discrimination is playing the race card. Racism is used as a crutch for those who lack merit, motivation, or drive. Racism will always be with us, so let's not waste time talking about it. These are all arguments which are used by inherently racist organizations or institutions or people to belittle the fact that racism exists. Look through the list of names of doctors who are under GMC investigation. It's publicly available. Log on now if you want. Look through the list of PAG or PLDP panel fitness to practice hearing names. These are a sea of ethnic names. You'll be hard pressed to find a Western name. This disproportionate prevalence can't be due to chance alone, nor can it be due to a lower standard of clinical care provision or rates of clinical negligence based on race or ethnicity. Therefore, this implies that there is an instant ethnic bias in the way that complaints are handled and set up, from the bottom up, from societal biases which may influence the complainant to lodge the complaint for possible vindictive or vexatious reasons, to the way the complaint is escalated through the local regulatory teams all the way up to the GMC, even the CQC. We'll be discussing this at Council at the RCGP National Council meeting tomorrow. We need to question the processes, policies, protocols, and the composition of these panels in terms of not only skill mix, but ethnic and racial proportional representation to reflect the workforce. There are so many Black and Asian minority doctors who feel that their mistakes are amplified and that they are far more readily taken to task and reprimanded for their mistakes. It has been said by many doctors that there seems to be no parity in the quantum of action that is taken when things don't go according to plan for ethnic minority doctors. We need to have a frank dialogue and have the difficult conversations with regulators and experts by lived experience around the same table and work towards righting these wrongs that have gone unchallenged and allowed to perpetuate over decades. We all feel comfortable speaking and acting in certain ways. Our accents, our intonation, when we speak, the way we dress, the way we use our mannerisms. It's not just ethnic minority groups. A popular example is Mrs. Bouquet or Mrs. Bucket from the sitcom One Foot in the Grave. How she would speak in a posh accent around certain people and act differently at home. It's a common phenomenon that Black and Asian people who work and live in predominantly white environments feel the need to change the way they act and speak in a way that feels natural to them so that they can fit in. They feel that they would be rejected or ostracized if they spoke or dressed in a natural way to them to feel comfortable. The belief of the standard language or appearance ideology, which is the stereotypical way that we should conform in order to gain acceptance, can be a consequence of microaggression. No one should have to feel guilty or ashamed of the way they feel comfortable speaking or dressing. What we find is that the overwhelming gold standard of the way we should speak is defined by what is considered acceptable by the predominantly white societal expectations. Anything deviating from this normal is often commented on or judged in the form of a microaggression designated to define or denigrate the person by this difference. Is it any wonder that minority groups then tend to form their own cliques and segregate themselves at school and in society because they feel uncomfortable around the white majority after being marginalized or taunted? This rejection forces segregation based on a particular protected characteristic. However, this can be a maladaptive coping strategy, as this marginalized group can feel viewed as the oppressors, as an unwillingness to integrate and assimilate, which then further deepens the divide. Ever hear of a rock and hard place? That's what ethnic minority groups tend to find themselves in. These are complex issues with no simple or straightforward answers or solutions, but that should not deter us from taking the first steps to acknowledge these difficult challenges and start to take action to drive positive change. I think it's beginning to happen. We have not only faced the challenges posed by the pandemic this year, we've seen the rise of global racial tensions, which have significantly shone a spotlight into the long-standing issues that have made people think twice about what they do and what's possible moving into the future. Racial gaslighting. I'd not heard of this term, but I've been on the receiving end of it. I'll work through some examples. As Black and ethnic minority people, racial gaslighting has been a painful experience that many of us have had to deal with at some point in our lives. You may already be familiar with the term gaslighting, which is a form of psychological abuse. This was defined after a 1944 film called Gaslight, a thriller about a young woman whose husband slowly tries to convince her she's going insane. However, racial gaslighting is related specifically to psychological abuse surrounding racism. Racial gaslighting often comes about when the victim is led to doubt and question their own sense of reality with regards to racism. I remember being called derogatory names by a man in London when I went to a conference because of the colour of my skin on the underground. Go back to your own country, you dirty terrorist. That's what he said to me. When I spoke to a friend that night about the incident, she questioned whether the person was really racist or had other issues going on that may have led him to act the way he did, mental health issues, societal problems. I wouldn't worry too much, she said. It's probably an isolated incident. I don't think racism exists really anymore. I used to get bullied about my hairstyle at school, she said, and that I wore a tie when no one else did. Bullies will always find differences to pick up on. If it wasn't race, it will be something else. She probably felt it would reassure me that racism doesn't exist and it's people like me that have to bear the brunt of it. My friend's dismissiveness and unwillingness to address the underlying problem in her own way to try and make me feel better is a prime example of racial gaslighting. It can have implications for a person's mental health. I remember feeling really low after this incident. I feel like I wasn't accepted for who I really am. It knocked my self-esteem to think that people want me to compromise my identity to be something that I'm not. The son of one of my friends, who's Asian, kept being asked at school by a certain group of boys if he was brown because he didn't wash. This obviously hurt his feelings and made him retract into his shell and really hit his self-confidence hard. His flamboyant, outgoing personality suddenly switched into an introverted shyness, and that spark in his eye was replaced by tears. The dinner lady tried to make him feel better by explaining to him that it was the small-mindedness of his friends, that they did not mean to cause him any upset. "Don't be so sensitive," she said. His teacher even downplayed the abuse by dismissing it by saying children can be unkind sometimes, and if they were only picking on you for your skin color because you are perfect in every other way. She tried to make him feel better. So does this mean his skin color is an imperfection? The thing that hurt me the most was she also said, they didn't call you any names. They were only asking you a question, and this is a perfect opportunity for you to educate them. Wow. What other victim of abuse, someone who's been sexually abused or physically abused or psychologically abused, would you ask them to try and educate their abuser? So he wasn't called a name. Does that make it okay? Is name calling the only form of racism that's significant or hurtful? Is it the boy's job to educate the bullies to convert this episode of racism into an educational opportunity? I think not. The above scenario is an example of a lack of education or understanding and can racially gaslight children from a very early age. You are left feeling like that you're the person with the problem. So 5 ways to stop racial gaslighting. If someone who is from an ethnic minority shares their experience of racism with you, learn to listen carefully to what they've said and to acknowledge their feelings. Educate yourself on racism and understand issues related to white privilege. Ensure you offer support and empathy and don't question a person's lived experiences of racism. Recognize if you have an internal defensive response to racism. And finally, call it out. Be an ally to those who have suffered from racism and the forms it manifests in. Professing colorblindness. When I look at you, I don't see color. Think about if you think it's a positive thing to say to someone. I've had it said to me by my close friends and family many times. This can be a form of microaggression, denying a person's color or racial or ethnic experience. There is only one race, the human race. That's been said to me before as well. And that denies a person's racial or cultural being. Comments such as, I'm not racist, I've got loads of Black and Asian friends. Close proximity or social interaction with these groups does not make you a few skin shades darker, and nor does it confer you automatic understanding of the experiences that they had to face. What it shows that the person making these comments heterogenizes a cohort of people into an overgeneralized category, which reinforces stereotypes. When the Black Lives Matter movement gained traction after George Floyd's murder, you may have noticed that All Lives Matter movement also started to become very vocal. Now, is it that the two are mutually exclusive? Is it that if someone thinks Black Lives Matter, they don't think that all lives matter? No, of course not. Is it that All Lives Matter movement think that no historic injustices were committed against Black people in the past, and therefore the inequalities and inequities arising from them need to be addressed? Is it that All Lives Matter thought that there was no discrimination in our society and therefore there should be no further discussion about addressing inequality. There are some who say all lives matter may have been a political, populist, far-right attempt to discredit Black communities. Let me give you an analogy. When breast cancer charities do fundraising to raise money and awareness for breast cancer, do the Heart Foundation or prostate cancer charities pipe up and start to argue that their cause is more worthy than theirs? That heart disease and prostate cancer matters more than breast cancer? Or start to take issue and protest that all cancers or all diseases matter? Or that the money being raised for breast cancer should go towards fighting heart disease and prostate cancer? That if you support raising awareness for breast cancer, that you somehow do not care about prostate cancer and heart disease? No, of course not. That would be abhorrent, distasteful, and completely unacceptable. Would this argument be granted the virtue, or even one line in a newspaper, or 1 minute on the news? Of course not, because it is nonsensical, illogical, and discriminatory. However, now apply this to the Black Lives Matter and All Lives Matter scenario. Do you start to see the similarities in the comparison? How much support and airtime did the All Lives Matter movement gain? A lot, let me tell you, a lot more than it should have done. Does this make us feel uncomfortable as a society that we did not do more to challenge these opinions in our modern day society in which we live? So, is the future bright? Is there hope? Yes and yes. We can drive positive, meaningful change and empower and uplift our own downtrodden, disenfranchised minorities, communities. Of course we can. From an institutional perspective, the hardest part is recognizing and acknowledging there's a problem. But the time has come now to move forwards from simply acknowledging that there's a problem to taking action. We need to increase diversity at a senior leadership level, not tokenism or tick boxes to fulfill quotas, but the right people for the right jobs to proportionately represent the membership or composition of the institution or organization. We need to adopt a zero tolerance approach and promote inclusion in our multicultural societies. We don't need virtue signaling or disingenuous corporate political correctness for the sake of ticking a box. This is retrograde tokenism and patronizing. Putting a slogan on a website or a billboard to make yourself feel better, or putting a certain quota of people with protected characteristics on the cover of a magazine is a backward step for the sake of doing so. We need to have genuine allyship and support to ensure we don't just talk about these issues, but we're taking action to overcome barriers in our society and improve equality, diversity, and inclusion. Take a break and reflect. Employ that filter to your internal monologue before you make a comment about someone or compare them to someone else. Ask yourself the question: how will what I'm saying about them make them feel? What is my intention in making this comment? And will it be likely that my actions have a negative impact on them? Can it or will it offend them? Is it necessary? And will it positively influence them or the task at hand? Is your comment productive? Learn. Every day's a school day for me. If there is even an ounce of doubt or uncertainty in your mind about the appropriateness or suitability of what you're about to say or thinking of saying it, just Google it. If you feel something that you're about to say may cause offense, take a few seconds. Research it, research the meaning of it and the history behind it, and think about whether you should say it. Intent. When we think about diversity training, what's the first emotion that comes into your mind? Is it apathy? Is it dread? Is it excitement? Mine is usually a sigh, because most of the inclusion and diversity training I've ever done is quite didactic and essential mandatory teaching. Political correctness for the sake of political correctness is not on. When training is reduced to tick boxes, then efficacy of that training is lost. retention of the content is reduced, and it simply is time you'll never get back again. The training should always begin with the why. Why are you there? Why and what do you want the outcome to be? What is inclusion? Is it about feeling comfortable and feeling wanted? Is it about common decency? And most of all, is it about kindness? Treating people and respecting them with compassion, respecting their experiences, their culture, their heritage, and finding common ground and discussing wholesome shared experiences can bring you together. And finally, in addition to showing how discrimination and unequal opportunity and equal opportunity harm ethnic minorities, it's important to explain how systemic biases can affect all of us and prevent us from achieving our full potential as a society. There is much research evidence to show that we can never truly become a cohesive and productive society while we allow racial inequality to persist. Ensuring equal opportunity for all is in our shared economic and societal interest. By helping the most vulnerable in our society, you are also helping everyone else. The economic, psychological, and existential benefits are limitless. Research also shows that people are more likely to acknowledge that discrimination against other groups is a problem and more likely to want to do something about it if they themselves have experienced it or will be affected by its far-reaching impact. Most people have at some point felt on the outside, or that they were unfairly excluded based on specific protected characteristics. Reminding people of this feeling can help them think about what racism and oppression really mean for others as well as themselves. Thank you all for listening. I've got so many other experiences that I want to share, so many experiences of my own life, which I've shared on YouTube. Just Google my name. There's a lot of videos out there. Hopefully it can help you to understand some of the experiences that ethnic minorities have to go through on a daily basis. And hopefully we're making a lot of positive, genuinely meaningful steps as a society and as a profession to counter racism and discrimination. Thank you so much for listening.